career in this community and in this city, which I have called my home for more than 40 years. As I look around this room today, some of you are the busiest people I know, and yet you managed to join us on unavoidably short notice for this announcement. You magnify the significance of this day and this announcement, and I thank you all personally for taking the time to be here with us this morning. In a moment, I'm going to introduce our speakers, including U.S. Congressman Richard Neal and Mayor Domenic Sarno. But first, allow me to recognize members of our legislative delegation. State Senator Adam Gomez. State Representative Carlos Gonzalez is not here yet, but I believe he's on his way. Representative Brian Ash and Representative Angelo Pupolo. Malo Brown, Chief of Staff for Representative Bud Williams, is with us this morning. And Lamar Cook, representing the Governor's Office. Thank you, Lamar, for joining us. Also in attendance today, several of our city councilors. I'm not sure if any of them made it yet, but if I missed anybody by omission, I apologize. I will catch up with you later. I think I've gotten everyone. And now it is my privilege to introduce the main event. So without further ado, I would like to introduce you to the Chairman, President, and Chief Executive Officer of Massachusetts Mutual, Roger Crandall.
Thank you, Kathy. Good morning, everybody. It is a real honor and privilege to be here today, see such a room filled with folks for such an exciting announcement. I'd just like to particularly thank Dr. Mark Keroack and everyone here from Baystate, such a critical part of our community. We always know what Baystate does, but boy, going through COVID really reminded all of us. So just really pleased to see you here today. Congressman Neal, Richie's here. I saw him somewhere. Of course. Again, Rich, what you do for our community in Washington is just absolutely unbelievable every day. I think everybody here knows it, but Mayor Sarno just, really boots on the ground, changing the trajectory here in Springfield, actually pulling in and looking at the construction kind of across the way, kind of really kind of came to mind as well. So fabulous to see you here today. So thank you. And all of the other representatives here, just want to thank you for being here. This is super exciting for the folks at MassMutual. We've got members of our finance team, investment team, and most importantly, our facilities team who've been working on this for almost 2 years. And this, to me, is really kind of what Springfield's all about. It's about good neighbors. It was almost exactly 173 years ago. In fact, it was on May 15th that MassMutual was started by 31 folks. Kind of unbelievable. 31 people raised $100,000, led by an agent for Connecticut Mutual, who then went on to become the first president of MassMutual. That $100,000 and 31 people today has grown to millions of policyholders and almost $35 billion in capital as MassMutual has become one of the largest life insurance companies in the U.S. and headquartered right here in Springfield. So it's just amazing to see that. So, of course, as time moves on, things change. We had buildings filled with paper on State Street. And guess what? We're not using that much paper anymore. So we've had these empty buildings. We've been thinking, what do we do with the buildings? We've got 100 acres, and we frankly don't need all the 100 acres. And when the opportunity came to work with Baystate to build a new community health center, it seemed like a natural. So we're very pleased today to announce that we're donating approximately 10 acres of land on our Springfield campus for the construction of this new community health center. We're also going to be providing financing for the project and also a $5 million grant from the MassMutual Foundation to help this all come together. And look, and I get the really easy job. I get to sit here and say we're doing it, and when they came to me with the proposal, I just got to say yes. But again, this represents the work of a lot of people across our community. We're going to be able to help well over 100, I think I've seen estimates of 145,000 people a year at this new center, give them state-of-the-art care, easy to get in, easy to get out. And this is just the kind of partnership that we're very proud to be with. So I am not going to talk more about what this is going to do. I'm going to let others do that. But again, just on behalf of the MassMutual policyholders, our board of directors, and all of our employees, really pleased to be able to do this today. So thank you very much, everybody, and I'll turn it back to Kathy.
And I do just want to acknowledge that the president of the Springfield City Council, Michael Fenton, has joined us. So Michael, thanks for making it over to be with us today. And now the president and CEO of Baystate Health, Dr. Mark Keroack.
Well, thank you. Good morning, everybody, and thank you very much, Roger. Today is a great day for Baystate Health, for MassMutual, and for the people of Greater Springfield. For generations, Baystate Health has proudly cared for the residents of Springfield at our 3 community health-based clinics, together with the Wesson Women's Clinic in the basement of Baystate Medical Center. It's been our mission for nearly 150 years to improve the health of all in our communities that we serve, regardless of their ability to pay. In the last 7 years, Baystate Health, Health New England, and Caring Health sponsored a Medicaid accountable care organization in which over 50,000 patients were cared for under a global budget. In partnership with organizations like the Food Bank, the Housing Authority, Legal Aid, and Behavioral Health Network, this payment model brought a focus on prevention and wellness. Through the ingenuity and hard work of our providers, many of whom are with us here today, we were able to keep patients healthier by attending not only to their medical needs, but also the social issues that impact health. Keeping patients healthy also helped lower costs, making it possible to expand to serve more of our community. However, we were held back by our facilities, which are crowded, aging, and hard to keep up to date. As we consolidated our suburban and rural practices into larger health and wellness centers, the differences between them and the clinics became stark, and we began to dream of a health and wellness center right here in Springfield. Over the last few years, we looked at several sites, but none was able to meet our needs. And then, nearly 2 years ago, I contacted Roger Crandall in the hope of acquiring the site of the former State Bowl on State Street, where I used to bowl. I suspect Mayor and Congressman Neal have bowled a few strings there. I learned at that point why MassMutual has become the giant financial services firm it is today. Roger immediately started thinking big and wanted to partner with us to make the center a reality. What came out of this vision is the largest philanthropic gift in the history of Baystate Health, directly benefiting the most vulnerable patients we serve. The planned center will bring together the adult and pediatric practices at our High Street Health Center, the practices at our Mason Square Health Center, and the Wesson Women's Clinic, which together see over 125,000 visits per year. It'll be located, as Roger said, on 10 acres of the former MassMutual campus on Wilbraham Road, with ample parking and on a PVTA bus route. We haven't yet finalized our plans for the design of the 90,000 square foot center, and we'll be seeking to begin a conversation with the community and with our providers to design features like our other health and wellness centers, with on-site lab, x-ray, pharmacy, and space for specialty practices. We're also envisioning adding community spaces and ways to bring our social service partners closer to the patients we serve. This space will also allow for expansion to nearly 150,000 visits a year, since the growing demand for care in our clinics has led to long waits in some cases. Finally, we're going to have a facility that's worthy of the commitment, creativity, and heart of our providers. And it wouldn't have been possible without the vision and generosity of Roger and the whole MassMutual team. I particularly want to thank Sean Anderson and Dennis Duquette of MassMutual, who partnered with Shane Newell and Scott Berg of Baystate Health early on to bring this project to life. I'm also grateful for the work of our facilities team under Dave Brown, our finance team under Ray McCarthy, and our clinical leadership under Drs. Paul Paralia and Dr. Andy Artenstein. I'm grateful for the steady support of our board member and MassMutual executive, Maddie Landau, and grateful to our other legislative leaders, the mayor for support through the ARPA program, and our state legislators through their various earmarks. The Springfield Hospital began its work in the city nearly 150 years ago because people of means felt an obligation to help those in need. Today, MassMutual and Baystate Health are doubling down on that proud tradition and committing ourselves to continue this noble purpose well into the future. Thank you.
And all of you have a front row seat to see history in the making. It's my pleasure to introduce our U.S. Congressman, Richard Neal.
Thanks. I've been around long enough to be reminded that Kathy Tobin used to put me on the grill when she was a reporter for Channel 4. Yeah. So this is terrific news, Your Honor, Roger Crandall, and Dr. Keroack for the city, and I think it reinforces the idea at a very tumultuous period of time about stability. When you hear about MassMutual, for example, and the vision all the way back to Jim Martin as the time when he was so instrumental in many of the downtown rehabilitation projects and the success even of the construction of Monarch Place, we're reminded that during that period of time, and incidentally, the first mayor of Springfield found time to run MassMutual, Caleb Rice. Yeah. So you've got some work to do, buddy. And to Mark Keroack, when you talk about 150 years of stability, and I think the mayor's keen eye for guidance, and I'm also reminded, of my interest in the lore of the city because we're under the watchful eye of Deacon Samuel Chapin. And Deacon Chapin, who sits next to the Carnegie Library on State Street, which is one of the most beautiful parts of the city if you are traveling east on a fall or a winter night when the leaves are off of the tree, you just get an understanding of what these institutions meant, not over decades, but now over centuries. That's how important they've been to all of us. And by the way, the humor there with the deacon, if you look at where he is sitting, his back is turned to the Anglican Church. And the Anglicans at the time, because of the Civil War in England, their argument was that he had come to his senses and he was on his way to join the Puritans at South Congregational Church. No small matter in our pretty fascinating history. So let me just make a couple of points as one who's been involved in the healthcare arena for a long period of time. Everybody understands now the Affordable Care Act is not going away. And you talk about the vagaries of public opinion. I remember coming down the steps of the Capitol on that day when we had finalized the vote, and there was a pretty intimidating crowd on the steps. We were not turned back by, the vagaries of opinion. So 20 million more Americans have health insurance today because of the Affordable Care Act. We're going to continue to improve it. I can predict with great certainty that as we proceed to this legislative session, the tax credits are going to remain. So there are people who now in the open marketplace can pick up a health care plan for sometimes under $100 a month. Pretty impressive and pretty important. So I think this is a really important day for the city, largely because the two individuals who have been so important to this community during their time as leaders, they're reinforcing their commitment to the city. That's a big, big deal. And I think whether it's in financial security that MassMutual, I think the second largest life insurance company in America, provides. And by the way, my first job, sweeping the floors there at 16 years old, and later on in life, a MassMutual pension. And the genius of Mr. Roosevelt's Social Security program allowed my aunt to raise us with my grandmother. And that's how we lived. And at Baystate, affiliated with UMass Medical School for primary care physicians. A lot of times in the modern vernacular of political discussion, if you're not ginning up conflict all of the time, if you're not using your thumbs or you're not running to the cable TV shows, you forget part of the real story, the substance of what is really done, where then people come to rely upon it, sometimes without the narrative. But the fact that they make this announcement today, that they continue to commit to our city and to the Pioneer Valley is really important. So, Mr. Mayor, to you and to the announcers today, thanks from the United States of America.
Well, I am proud that the Congressman still speaks to me after all these years. I am a proud representative of Baystate Health, certainly. And today I am very proud and honored to be a citizen of the city of Springfield. My mayor, our mayor, Domenic Sarno.
Thanks, Dr. very much. It's almost like a punchline here. The head of MassMutual, the head of Baystate, Congressman and mayor walk into a bar. But the punchline is better and accessible health care. And that's the biggest punchline of the day. So, and to Dr. Keroack, deja vu all over again. For about a year and a half, we stood at this podium during the COVID-19 worldwide pandemic every Monday morning to give our updates really to Western Massachusetts on that. And to Roger Crandall, 173 years. And you look fantastic, by the way, too, Roger. Anytime the city has needed anything, you've been there, and you two are titans of your industry and coming together as one, once again, for the betterment of all our residents and business community, no matter what creed, color, and background here is absolutely tremendous. And of course, my pipeline to federal government, he's been a great liaison, and once a mayor, always the heart of a mayor, Congressman Neal. This deal came about with the ARPA money, and Richie, I got to thank you. Many times we had those meetings with the Treasury officials direct on how we could expend those funds, and one of the expenditures was nearly $1 million to Baystate to help put this together with the generosity, tremendous generosity of MassMutual to give this health and wellness center. And God knows how hard all our medical officials work. It's much more appreciated now since the COVID-19 pandemic, but it's just overwhelming the needs that we have, especially in urban centers across America. And to have this state-of-the-art wellness center being put up very accessible in the State Street corridor, which is going to enable probably maybe 20,000 more patients to be looked at, is going to be so helpful. Many of us at times, with our family or friends or ourselves, when you go to an ER and the doctors, nurses, they're working feverishly, but the waits are long. The more we can do proactively, preventively, is going to lessen that state, and it's going to lessen people getting sick with illness and get them better. So this massive project is going to be fantastic, coming together, all for the benefit of the people that are in need. So I look forward to continue to collaborate with MassMutual and Baystate and Congressman Neal as we continue to move our city of Springfield forward. But the effort on health care, I mean, the old adage, if you feel good, a lot of things can happen at that point in time. So we look forward to the construction, and again, as two titans of industry come together for the betterment of our Springfield community and beyond. So to all involved, thank you very, very much. And I'll turn it back to our mistress of ceremonies, the lady in red, Kathy Tobin.
And now I'd like to introduce our state senator, Adam Gomez.
Thank you, Kathy. Thank you, distinguished guests, Roger Crandall, Dr. Keroack, Mayor Sarno, and my friend and colleague on the federal level, Congressman Neal. My name is State Senator Adam Gomez. Very proud to be here. I should be in Boston, but the truth is, when it comes to an announcement of this great magnitude and my personal touch and involvement with it, I thought it was so important for me to be here and say a couple words, especially on how important when it comes to health. And it's not no secret that when it comes to health, I had my challenges in health, and when it comes to preventative medicine, this is something that I will be taking the mantle on a consistent basis, because we want to make sure that we are taking the proactive step forward to make sure that we can unclog certain systems, especially our emergency room. And I know that this process and this project is going to take some time. So this center will have a greater access to the public. For transportation, ample free parking that you've heard, and also a place where organizations can have a part of being a part of the community and call home. With this new community health center and wellness hub in place, Baystate Health will consolidate services. And it's co-located in a community health centers where you'll see the Baystate Mason Square Health Center and the Adult and Pediatric Health Centers on High Street and the Western Women's Clinic to be comprised in one location. MassMutual, as you've heard, has done an abundance not only on this project to help kick it off, but also I just want to a round of applause for their investment within the whole greater Springfield community. Thank you, Roger Crandall, for everything that you do. I want to emphasize this is not about closing services or reducing services. It is about bringing services together to a new, robust, centralized health center and wellness hub where we can provide more services and improve access. The value of our partnership here with the community, patients, and providers is invaluable. And the vision for us to use of donated funds and also the new health centers to improve access and build upon the services that are currently provided. When this dream, and at first everything starts with a dream, then it becomes an idea, and obviously we start putting the dream on paper. And when I was presented with this idea, and just with the investment from the municipal partnership as well, I just could not fight on the Senate side in partnership at that time with our Senator Eric Lesser and also with our House legislators that all of them can't be here. Just want to announce Jake Oliveira that now is our partner here in Springfield, Senator for the other pieces that I do not represent within the Hampton District. And then also just to mention also, I think, Representative Orlando Ramos, which was missed. But I just wanted to just say that the Springfield delegation is extremely strong, extremely able. We have been able to produce large and influential and impactful amounts of money. And the first time the state was able to use a lot of these federal dollars that came from the federal government, I was able to secure at first $1 million that came from the Senate. And I know that the legislature after was able to secure another $1 million. So what you see from the municipal government through the hard work of the City Hall and also through the state and the Senate, we've been able to put together $3 million for this investment. And we're very, very proud of what's happening here in the middle of the 10th Hampton District. And I really appreciate the opportunity of my office's involvement. I just want to say to the Baystate leadership team that stays in constant communication with me, I salute you, thank you, and all of our healthcare professionals that are here also in support. You guys do amazing work, and I am a testimony to when we have necessary investments within our community, great things happen, and that's one reason why I'm still alive. So with that, this is why results matter. This is why we are put in the positions that we are in, because we have to start putting and impacting our community and making necessary impact for the future of our children and also to the ones that still need our help, and that's our elderly. So with that, thank you. I appreciate it. And I'm going to be running out of here because I got to get back to Boston to bring more money back to you guys. Thank you.
Thank you, Adam. And he's going to be passing State Representative Carlos Gonzalez, who did not apparently make it for this morning's announcement. But if he were here, and he does represent me, so I feel I can say that I know he would at the very least say, muchas gracias. And he would appreciate that. So now we're going to move on, and I would like to introduce the Executive Director of the Springfield Housing Authority and a Baystate Health trustee, Denise Jordan.
Good morning. I would like to thank MassMutual for their generous donation of land and, most importantly, funding for this project. MassMutual, which has always been known as the castle on the hill for those of us residing in Mason Square, has always been a constant. You've always been a great neighbor and community partner, and the residents and businesses of Mason Square, thank you. As a proud product of Mason Square and a trustee of Baystate Health, it brings me great joy to know that Baystate's commitment to bridging the gap to health disparities and their efforts to combat the inequities in health care access to people of color, they chose Mason Square as the site of their new community health center. This location is a huge opportunity for the residents not only of Mason Square, but for those surrounding what we call the square. But it's also a great location that will benefit the schools that surround that proposed site. Central High School, SciTech, even Margaret C. Ells, right? So it's a great thing to know that, but also higher ed. AIC, WinU, will also benefit from having access because they have programs that deal with health care. The Boys and Girls Club, everybody's gonna be looking to you, to us, Baystate, because we're going to be a greater part of the neighborhood, and we're gonna increase our community partnerships. A bonus, being close to the Ray Jordan Senior Center, shameless plug. The seniors will have the opportunity to access health care, but make it in time for lunch at the senior center because of the proximity. So that's also a great thing for all of us. On behalf of the proud residents, past and present, I extend a heartfelt thank you to MassMutual CEO Roger Crandall, outgoing, retiring CEO of CEO of Baystate Health, Mark Keroack. Thank you for your service. It's been an honor to serve under you. To our esteemed Congressman Richard Neal, the People's Mayor, Mayor Sarno, and all of those who had a hand in making this dream become a reality. Today is a great day for the residents of Mason Square. It's a great day for the city of Springfield, and it's a great day for MassMutual and Baystate Health. Thank you so much.
And now I would like to introduce the Chief of the Division of General Internal Medicine at Baystate Health, Dr. Paul Paragla.
I'd like to take a moment to express a sense of hope and anticipation that this announcement brings. Those of us who chose to work in community health did so for a reason, to serve the people who need us most. The prospect of a purpose-built facility that will make easier the oftentimes difficult and complex work of wellness and healthcare delivery, being the exemplar for health equity, addressing to the greatest extent possible health-related social needs, and educating the healthcare professionals of the future is thrilling. This structure will house primary care, comprehensive women's health, integrated behavioral health, and specialty services for newborns to those of the most advanced age. It will allow us to do so in a collaborative, integrated, team-based environment. But the efficiencies aren't just for us. Our patients will be able to get their medications, testing, and other services all under one roof. While it'll be wonderful to work in a building that makes our jobs easier, that we as healthcare professionals can look at each and every patient directly in the eye and say, we built this for you, will bring us a sense of pride that is without measure. We are so very appreciative of this journey we are about to set upon together to advance the health and wellness of the communities we serve through this new facility. Thank you.
So that is the big story of the day. And I thank you all again for your presence. Remember, this is just the beginning of a very important journey. We're going to be working with all of you, we hope, as well as members of this community to make this a real gift to the city of Springfield and the citizens who live here. So thank you very much.